Understand cancer in order to overcome it. National Guidelines of Cancer for Multicultural Families in Korea, English. Contents: 10 Rules for Citizens to Prevent Cancer. Guide to National Cancer Screening Program. Medical Expenses Support Project for Cancer Patients. 10 Rules for Citizens' Cancer Prevention. Cancer is preventable. Cancer is the #1 cause of death for Korean citizens, and if a person lives to the average life expectancy, 81 years, 2 out of 5 males and 1 out of 3 females may contract the illness. According to the World Health Organization, WHO, out of the entire population with cancer, 1/3 can be prevented, 1/3 can be completely cured through early diagnosis, and the remaining 1/3 can overcome the illness if proper treatment is received. Among the deaths from cancer, about 20% is due to smoking, 10% from drinking and dietary reasons, and 5% from obesity and lack of physical activity. That is, the majority of deaths from cancer are caused by factors of our daily habits. Thus, cancer can be prevented through the execution of cancer-preventing habits that can be applied in everyday life and through early examinations. 10 Rules for Citizen Cancer Prevention. Citizen Cancer Prevention Guidelines. Do not smoke cigarettes and avoid secondhand smoke. Eat plenty of fruit and vegetables and maintain a diverse, balanced diet. Do not eat food that is too salty or burned. Avoid the daily consumption of even small amounts of alcohol to prevent cancer. Walk or exercise to produce sweat at least 5 times a week for 30 minutes a day. Maintain a healthy weight for your body size. Receive vaccination for hepatitis B and cervical cancer according to vaccination guidelines. Maintain a safe sex life to avoid sexually transmitted diseases. Obey safety and health guidelines on site, in place to avoid exposure to carcinogenic substances. Receive medical examinations according to early cancer screening guidelines. Guide to National Cancer Screening Program. What is National Cancer Screening? NCSP offers cancer screening services for the 5 major cancers in Korea based on the cancer screening guidelines developed in 2015 by the Ministry of Health and Welfare, National Cancer Center, and related professional medical associations. NCSP offers 5 cancer screening services at no cost to medical aid beneficiaries and the lower 50% of members based on the amount of insurance premiums they pay in health insurance. The costs for screening are covered by the government. For what purpose is the National Cancer Screening Service carried out? National cancer screening is conducted by the government at the national level, which aims to decrease cancer incidence and mortality rate to increase cure rate by early detection. National Cancer Screening Program, NCSP. Stomach cancer, liver cancer, colorectal cancer, breast cancer, and cervical cancer are some of the more prevalent cancers occurring in Korea. These cancers can be relatively simple to be discovered in advance, and if found at an early stage, 90% or more of the patients can have complete remission of the cancer. Stomach cancer, men and women over 40 years old, biannual liver cancer, chronic hepatic disease patients over 40 years old due to cardiocirrhosis, hepatitis B antigen positive, hepatitis C antibody positive, hepatitis B or C virus, 6 months colorectal cancer, men and women over 50 years old, annual breast cancer, women over 40 years old, biannual cervical cancer, women over 20 years old, biannual. Who can receive the NCSP? Medical aid beneficiaries. Health insurance subscribers or dependents belonging to the lower 50% of insurance payment imposed in the year, based on the amount imposed in November of the previous year. If one has been diagnosed with colorectal or liver cancer and registered under the Special Case Estimation System, he or she is excluded from the National Cancer Examination Program for the particular cancer. Special Case Estimation is a system that aims to alleviate the burden of medical expenses paid by a cancer patient for treatment of the particular cancer by alleviating a percentage of the patient's out-of-pocket expenses for 5 years from the registered date. When do you receive cancer screening services? You can receive the cancer screening services until December of this year when you receive the Notice of Screening Program from the National Health Insurance Service. 2-step screening services of stomach cancer, liver cancer, and colorectal cancer screenings are available until January of next year. Where can you receive the cancer screening services? You can visit any healthcare institution listed in the guide provided by the National Health Insurance Service. How can you receive the cancer screening services? You have to bring both the cancer checkup table proving that you are a recipient of NCSP and an identification card, health insurance card, or medical aid card. If you are not informed or do not have a cancer checkup table, you can make an inquiry to National Health Insurance Service 1577-1000 or confirm that you are the recipient of the cancer screening program by visiting the portal site of the National Health Insurance Service, http://nhis.or.kr. You can print out a cancer checkup table on the portal site. Medical aid beneficiaries can print out the cancer checkup table at the community public health center near your residence. Medical Expenses Support Project Guide for Cancer Patients. Why conduct a financial aid program for cancer patients? It is to support the medical expenses for low-income cancer patients to reduce their financial burdens and increase the rate of successful treatment. It is difficult to diagnose and prevent pediatric cancer early since there are many hereditary factors involved. However, early treatment has shown great results, 78% 5-year survival rate, and the lifespan after treatment is long. The project is implemented as a necessary policy support for pediatric cancer patients. Also, it is to support medical expenses for patients who have been diagnosed of cancer to reduce their financial burdens and increase the screening rate of national cancer examinations. Details of the financial aid program for cancer patients as of March 2019. Pediatric cancer patients. Who is a pediatric cancer patient? Cancer patients who are 18 years old or younger. Subject for support. 1. Pediatric cancer patients who are medical aid beneficiaries or belong to the near poverty group subject to copayment reduction. People who belong to CE codes of health insurance card. The above status of healthcare is available to confirm on your own healthcare insurance card or medical aid card. You can also confirm your status at the community public health center. 2. Pediatric cancer patients among health insurance subscribers who are qualified to become a recipient of this program based on their household income and property. To determine whether financial support is needed, the Community Health Center will investigate the income and property of pediatric cancer patients' households. Those excluded from support. Those who have foreign nationality, excluding refugees, according to the Refugee Convention. North Korean refugees or Sakhalin Koreans who have returned home permanently, and those who have immigrated overseas. Supported cancer types. All types. Supported expenses. Leukemia. Max. 30 million Korean won out of the year's total medical expenses, 20 million Korean won for all other types of cancer excluding leukemia, 30 million Korean won for stem cell transplantation. Supported period. Applicants must be under 18 years of age at the time of application. Those who have already received support may continue to receive assistance until the end of the year in which the patient reaches 18 years of age. Scope of support. 1. Medical costs-related examination, diagnosis, in the process of cancer diagnosis. 2. Cancer treatment costs after cancer diagnosis, final diagnosis. 3. Medical costs related to complications caused by cancer treatment. 4. Medical treatment fees for metastatic and recurring cancer. 5. Medical costs related to medical expenses. Adult cancer patients. Recipients of national cancer screening among health insurance subscribers. Subject for support. 1. New cancer patients identified by National Cancer Screening Program. Required primary test. 2. If cancer was diagnosed through an individual examination within 2 years after the first national cancer examination date. Supported cancer types. Stomach cancer, liver cancer, colorectal cancer, breast cancer, and cervical cancer. Supported expenses. Support up to max 2 million Korean won out of the year's treatment fees. Supported period. A maximum of 3 consecutive years. Scope of support. 1. Medical costs-related examination, diagnosis, in the process of cancer diagnosis. 2. Cancer treatment costs after cancer diagnosis, final diagnosis. 3. Medical costs related to complications caused by cancer treatment. 4. Medical treatment fees for metastatic and recurring cancer. 5. Medication costs related to medical expenses. The range of foreigners who are in the target of financial aid program, both medical aid beneficiaries and adult lung cancer patients. Out of those registered as foreigners. 1 who is married to a Korean citizen and either she or his spouse is pregnant. 1 who is married to a Korean citizen and is raising a child that is 19 years of age or older and holds Korean citizenship. 1 who is living with direct ancestors that hold Korean citizenship of his/her spouse. 1 who is divorced with a Korean spouse or whose spouse has been deceased and is raising a child that is 19 years of age or older who holds a Korean citizenship or is pregnant with a baby created with the deceased spouse. Raising only when the parent living with the child. Children who are entrusted to a third-party care facility are not regarded as being raised. Foreigners who are acknowledged as refugees by the Minister of Justice in accordance with Article 2, Paragraph 2 of Refugee Act, and are currently residing in Korea in accordance with Article 32 of the same Act. Adult cancer patients, medical aid beneficiaries, and near-poverty groups that are subject to co-payment reduction. Subject for support. All patients of cancer who are 18 years old or more among medical aid beneficiaries, as well as near-poverty groups that are subject to co-payment reduction, people who belong to CE codes of health insurance card. Supported cancer types. All primary cancer types. Supported expenses. Support up to max 1.2 million Korean won out of the year's treatment fees, max 1 million Korean won of non-payment shares. Supported period. A maximum of 3 consecutive years. Scope of support. 1. Medical costs related examination, diagnosis in the process of cancer diagnosis. 2. Cancer treatment costs after cancer diagnosis, final diagnosis. 3. Medical costs related to complications caused by cancer treatment. 4. Medical treatment fees for metastatic and recurring cancer. 5. Medication costs related to medical expenses. Adult cancer patients, lung cancer patients. Subject for support. 1. Lung cancer patients who are 18 years old or more among medical aid beneficiaries, as well as near poverty groups that are subject to co-payment reduction. People who belong to CE codes of health insurance card. 2. Lung cancer patients of age 18 or older from among health insurance beneficiaries whose health insurance fee charged in January of the registered year suits the criteria. Supported cancer types. Primary lung cancer. Supported expenses. 1. Medical aid beneficiaries as well as low-income households. Support up to max 1.2 million Korean won out of the year's treatment fees, max 1 million Korean won of non-payment share. 2. Health insurance subscribers. Support up to max 2 million Korean won out of the year's treatment fees. Supported period. A maximum of 3 consecutive years. Scope of support. 1. Medical costs related examination, diagnosis in the process of cancer diagnosis. 2. Cancer treatment costs after cancer diagnosis, final diagnosis. 3. Medical costs related to complications caused by cancer treatment. 4. Medical treatment fees for metastatic and recurring cancer. 5. Medication costs related to medical expenses. Contact info for cancer organizations. National Cancer Information Center 1577-8899. National Health Insurance Service 1577-1000.